everyone, welcome back. And for those of you who are new, my name is Joy and I am living and thriving with an incurable autoimmune disease called systemic lupus erythematosus. Feel free to join me through the trials and triumphs of my journey. Please subscribe, like, and watch as I manage my symptoms with the purpose of living a healthy, happy, and long life. Today's blog topics, we're going to touch on some of the most frequently asked questions that I receive when sharing my lupus diagnosis with family, friends, and coworkers. Some of these are common questions and some questions are not so common. So here we go. My very first question is, what is lupus? Lupus is a chronic autoimmune disease that affects many different parts of the body. Inflammation occurs when the body's immune system attacks itself because it cannot distinguish between healthy tissues and unhealthy invaders such as bacteria and viruses. No one typically dies from lupus. However, this disease can cause damage to your blood cells, joints, skins, and more major organs such as your kidneys, brain, heart, and lungs. Who is typically diagnosed with lupus? Lupus primarily affects women, and the symptoms start between the ages of 15 and 45 years old. In many cases, such as my own, my symptoms started in my early teens, but it was decades before I was diagnosed with systemic lupus erythematosus. Are there certain groups of people that are diagnosed more often than others? Although women are 3 times more likely than others to get diagnosed, this does not mean that men are excluded from getting this disease. People of all ethnicities can get lupus. However, it is more common in populations such as African Americans, Latinos, Asian, and Native Americans. Is lupus hereditary? 10% of lupus patients have someone in their immediate family who has the disease, and studies have shown that hereditary plays a key role. However, environmental factors can't be ruled out either. How is lupus diagnosed? Lupus is diagnosed through various means. Some of those are extensive blood tests, symptoms, and family history. What is an ANA test? This test detects the anti-nuclear antibodies in your blood. How many types of lupus are there? There are multiple types of lupus. There is systemic lupus erythematosus, also known as SLE. This is the most common type of lupus. It accounts for about 70% of cases. There is cutaneous lupus erythematosus, also known as CLE. This mostly affects the skin. There's a drug-induced lupus erythematosus. In this case, a particular drug can cause the immune system to overreact and develop lupus-like symptoms. There's neonatal lupus erythematosus. It's a rare case, but caused by the autoimmune reaction in the mother. This is not an infant form of lupus. Next question. How did I get lupus? Like many others, my symptoms developed over time. Some developed slowly and others appeared suddenly. The symptoms are referred to as episodes or flares. When you experience a flare, your body is telling you that there is an increase in your disease activity. Looking back over the years, I can remember times and places when and where I experienced flares, but at the time, I didn't know that these symptoms were related to lupus. Is lupus contracted through sex? You can rest assured, lupus is not a sexually transmitted disease. You cannot catch lupus or give lupus to someone else. Lupus develops in a response to a combination of factors both inside and outside the body, including hormones, genetics, and environment. Can I have a child if I have lupus? Childbirth is possible for lupus patients. It's very important that you are under the care of an OBGYN who is familiar with caring for patients with lupus. What is the cure for lupus? Unfortunately, there is no known cure for lupus at this time. Is lupus a progressive disease? Does it get worse over time? Systemic lupus erythematosus gradually gets worse over time, and damage to major organs of the body can be life-threatening if not treated properly. How long can I live with lupus? If you live a healthy lifestyle, are properly treated, and follow the advice of your doctor, most lupus patients can live a long life. What are some of the most common symptoms of lupus? There are many symptoms of lupus. Some of those symptoms are extreme fatigue, muscle and joint pain with or without swelling, fever, rashes, chest pains, hair loss, sensitivity to sun or light, kidney problems, stomach issues, weight gain, mouth sores, anemia, blood clotting, memory loss, eye disease, eyelid rashes, just to name a few. How can I get diagnosed for lupus? For starters, you can request an anti-nuclear antibodies test from your primary care physician. If I have symptoms, what would you suggest? I would suggest that you have a conversation with your doctor about your concerns immediately. Is there a particular diet that lupus patients should follow? There is no specific diet to lupus. However, lots of fruits and vegetables and plenty of water are key to any well-balanced diet. Whole grains and a mix of healthy protein are best. I will say some foods to avoid are garlic, alfalfa sprouts, and echinacea. These have been known to increase your flare-ups. What types of doctors treat lupus patients? I would say find yourself a good rheumatologist. Is chemotherapy a treatment option for lupus? Doctors have used chemotherapy drugs to treat lupus. These medications suppress overactive immune reactions, helping ease inflammation, limit organ damage, and improve quality of life. What other types of treatments are available for lupus patients? The treatments that are available focus on improving your quality of life by controlling the symptoms and minimizing the flare-ups. There are several prescription drugs on the market. However, I myself opt for herbal and homeopathic treatments. If I'm diagnosed with lupus, am I eligible for disability? Social Security pays disability benefits to people who have worked long enough and have medical conditions that prevent them from working, or is expected to prevent them from working for, at the very least, 12 months. For more information, I would suggest that you contact your SSD. In wrapping up, there are two things I want you to remember. If you're a person without lupus, your immune system normally makes antibodies to help you fight infection. If you're a person diagnosed with lupus, the anti-nuclear antibodies in your system often attacks your body's own tissue, specifically targeting your cells. If you have any additional questions or comments, please link them below. And until next time, I'm sending you love and light. Bye for now.